Okay, we're live.
Welcome, everyone. My name is Cindy Tamayo. I'm the chair for the Hawaii State Board. I'm here by myself in my office. We are now going to play a short video on how the virtual meeting is going to be conducted.
Welcome to the Professional and Vocational Licensing Virtual Board Meeting.
When the meeting begins momentarily, the chair will take a roll call, explain any specific rules for this particular board, and then move to public comment. The name of the board member will appear on the bottom left-hand corner of your screen. For instance, this is board member Y, and this is board member E. Public testimony will be accepted at the beginning of the meeting and before each agenda item. You can indicate that you are ready to testify by clicking on the Raise Hand button being circled by the mouse on your screen now. At the appropriate time, the board will recognize you to speak and ask you to unmute your mic as shown here. Again, public testimony will be accepted at the beginning of the meeting and before each agenda item. Public attendees will not be able to unmute their microphone until recognized by the board. Public attendees who are recognized to testify will be asked to identify themselves by name and their affiliated organization if applicable. Please mute your microphone when you are finished speaking as a courtesy to others and members of the board. Public attendees will not be able to unmute themselves after the testimony is completed unless recognized again after raising their hand. At some point during the meeting, the board may choose to move into executive session. When the board moves into executive session, the board members' microphones and video feeds will be turned off, and a similar screen as you see now will be displayed. When the board returns from executive session, their microphones will be turned on as well as their video cameras.
Welcome again to the Professional and Vocational Licensing Virtual Board Meeting.
At this time, the chair will call the meeting to order and take a roll call, as well as explain any additional rules that may be specific to this board.
Okay, to view the meeting and provide live oral testimony, please use the link at the top of the agenda. You will be asked to enter your name, and the board requests that you enter your full name, but you may use a pseudonym or other identifier if you wish to remain anonymous. You will also be asked for an email address. You may fill out the field with any entry in the email format. Your microphone will automatically be muted. When the chairperson asks for public testimony, you may click the raise hand button found on the Zoom screen to indicate that you wish to testify about that agenda item. The chairperson will individually enable each testifier to unmute their microphone. When recognized by the chairperson, please unmute your microphone before speaking and mute your microphone after you finish speaking. Regarding phone access, if you can't get internet access, you may get audio-only access by calling the Zoom phone number listed at the top of the agenda. Upon dialing the number, you will be prompted to enter the meeting ID, which is also listed at the top of the agenda. After entering the meeting ID, you will be asked to either enter your panelist number or wait to be admitted to the meeting. You will not have a panelist number, so please wait until you are admitted to the meeting. When the chairperson asks for public testimony, you may indicate that you would like to testify by entering the asterisk and then 9 on your phone keypad. After entering the asterisk, then 9, a voice prompt will let you know that the host of the meeting has been notified. When recognized by the chairperson, you may unmute yourself by pressing the asterisk and then the 6 on your phone. A voice prompt will let you know that you are unmuted. Once you're finished speaking, please enter the asterisk and then 6 again to mute yourself. For both internet and phone access, when testifying, you will be asked to identify yourself and your organization, if any, that you represent. Each testifier will be limited to 5 minutes of testimony per agenda item. If connection to the meeting is lost for more than 30 minutes, the meeting will be continued on a specified date and time. This information will be provided on the board's website at http://cca.hawaii.gov/pvl/boards/physical therapy/suite meeting_schedule. Instructions to attend State of Hawaii virtual board meetings may be found online at the same general area. Okay, I'm now going to call the meeting to order. I will take roll call of the board members. Members, please respond by saying here, and please state if anyone else is with you in the room. Thank you. Ross Lum,
Here, I'm alone.
Stacy Kali'inoi,
I'm here and I'm alone in this room.
and Michelle Chi.
I'm here and there's no one else with me in this room.
Great. We have a quorum, and I will now call this meeting to order. Okay, our first thing on the agenda is the agenda is posted on the state electronic calendar as required by HRS sections 92-7B. Our first order is the approval of the board minutes from November 12th, 2024. Is there anyone that would like to testify on this matter?
Thank you, Chair. This is Johnny. We do not have anyone requesting to provide testimony.
Thank you. So seeing none, I, Cindy Tamayo, do move to approve the minutes. I need a second by saying your name, and I second the motion.
This is Michelle Chi and I second the motion.
Thank you. Is there any further discussion? No. Okay, we can move on to the next item. Chapter 91, Hawaii Revision Statutes, Adjudicatory Matters. This has been asked to be deferred by Ms. Romig.
Yes, Chair, sorry. We need to make sure that the voting for the minutes, so we made motion.
Thank you. Thank you. Okay, sorry, there is a motion on the floor to approve the minutes from November 12th. I do need to do it individually, yeah, because we're virtual.
Well, yes, or if everyone is.
Does anyone? Yeah. Does anyone oppose the passing of the board minutes from November 12th, 2024? Seeing none, then the motion carries. Now we'll move on to the Chapter 91 Hawaii Revised Statutes, Adjudicatory Matters, which have the request from Ms. Romig was to be deferred. Right. Okay. Next. The continuing competence course approval requests. Is there an attendee that wishes to speak to any of these? Do I have to read every single one of these? There's a whole lot of them. I can. I mean, I'm fine, but okay, I will. Bailey 4, online independent study on demand for 12 units. A clinician's guide to lower extremity differential diagnosis of the neck and shoulder, 3 units. A clinician's guide to lower extremity differential diagnosis pathologies and special tests, 4 units. Hawaii Physical Therapy, Ethics and Jurisprudence, 2 units. Bridging the Gap, the shoulder from rehabilitation to aftercare, 2 units. Fractures from the nose to the toes, 2 units. Fractures, a therapeutic overview, 1 unit. Hip, knee, and ankle arthroplasty, surgical and treatment approaches, 2 units. Joint mobilizations for the lower quarter, 2 units. Joint mobilizations for the upper quarter, 2 units. Orthopedic rehab red flags, 1 unit. Rehabilitation of the shoulder, 2 units. Rotator cuff disorders, 2 units. The knee joint anatomy, testing and diagnosis and treatment, 2 units. The hip anatomy examination and treatment, 2 units. The sacroiliac joint, anatomy, testing, and treatment, also 2 units. Scapular dyskinesis, 2 units. Stress fractures for 1 unit. Upper extremity total joint arthroplasty and more, 1 unit. Concussions, education, testing, and management, 2 units. Rehabilitation of the golfer, 2 units. Rehabilitation of the overhead athlete, 2 units. Return to sport, guidelines to testing for the lower extremity, 2 units. The throwing shoulder, 2 units. Treatment of the runner, 2 units. Weight loss for athletes, a therapist's guide, 1 unit. Evidence-based primary care screening foundations, 2 units. Evidence-based primary care screening symptoms, part 1, 2 units. Evidence-based primary care screening symptoms, part 2, 2 units. Functional performance measures for older adults, 2 units. Dance rehab, preseason screen, nutritional concerns, common injuries, treatment strategies, 3 units. Hip, foot, and ankle pathology in dancers, a surgeon's perspective, 1 unit. Introduction to orthopedic dance medicine, 1 unit. Assessment of functional skills and educational environment, 1 unit. Building a strong core, enhancing school function through therapy using PIJA, 2 units. From delivery to discharge, understanding the role of therapy in the NICU, 2 units. Pediatric telehealth therapy, case management, parent training, behavioral challenges, 2 unit. Autoimmune diseases, an introduction to rehabilitation and QOL issues, 2 units. Dementia, understanding the science, symptoms, and stages for optimal patient care, 1 unit. Facial rehabilitation, 4 units. Lumbar stenosis, 2 units. Using dance with Parkinson's disease, 1 unit. Pelvic stability, 1.5 units. Pilates, an adjunct for rehabilitation, 2 units. Push, pull, squat, hinge, analyzing and improving 4 common movement patterns, 2 units. Amyotrophic lateral sclerosis, 2 units. Balance and vestibular training, dizziness, falls, and BPPV symptoms, 2 units. Intro to multiple sclerosis, a therapist guide, 2 units. Neuro-oncology, outcome measures for therapy, 2 units. Neuroplasticity, 2 units. A clinician's guide to lower extremity differential diagnosis, 2 units. A pediatric hand explained, 2 units. Management of selected shoulder and elbow injuries in the skeletally immature patient, 2 units. Cultural competency and implicit bias in healthcare, 2 units. Patient education, clinical tools for improvement, 1 unit. Management of lower extremity injuries in the skeletally immature patient, 2 units. Preventing sarcopenia, 2 units. Effective strategies to address cognitive and memory decline, 3 units. Diabetes in the older adult, 2 units. Myofascial mobilization, 12 units. Pediatric myofascial release, 12 units. Myofascial release, 20 units. Facial pelvis myofascial release, fascial pelvis myofascial release, 20 units. Cognitive and memory decline in the aging brain, assessment and intervention, 2 units. Myofascial unwinding, 20 units. Myofascial release 2, 20 units. Women's health myofascial release, 25 units. Advanced full body level 1, 7.5 units. Advanced full body online, 3.5. Advanced full body level 2, 7.5. Lower extremity level 1, 15 units. Nerve, 22.5 units. Falls prevention, evaluation and treatment, 4 units. Pediatric functional gastrointestinal disorders, PEDS 2, 11 units. The pelvic floor, the diaphragm, the core, and their role in postural development in children, 6 units. And finally, an eclectic approach to spinal mobilization and manipulation for 16 units. That's a mouthful. Does anyone have any testimony they would like to give on these courses?
Thank you, Chair. We do not have anyone requesting to provide testimony.
Okay. Do we have any board members that want to say anything? Okay, seeing none, I, Cindy Tamayo, move to approve these courses. I need a second by saying your name, and I second the motion.
Stacy Kelly, I second the motion to approve these courses.
Okay. Does anyone have any opposition to passing these courses? Seeing and hearing none, the motion carries. Okay. Now, at this time, I, Cindy Tamayo, make a motion to move into executive session to consider and evaluate personal information pertaining to the application licensure for physical therapy, John Fox, Janice Pitts, Tyler Cronkist, and the PTA application for Erica Pinera and Dylan Enriquez.
Chair, I think we have Erica here, but Erica, you can provide your oral testimony in executive session. So we will be bringing you into executive session, not in open session. You can go ahead and make a motion to go into executive session.
I did. I just need a second.
I second
Ross.
the motion.
Second the motion. Sorry.
We all second the motion. Any opposition to the motion? Okay. Hearing none, motion carries. We'll go into executive session. Thanks, Stacy. Ross? Oh, yay. Okay. Looks like we're all here. Okay, in the matter of the applications, do I have a motion regarding the application for Mr. John Fox?
This is Michelle Chi. I motion to approve this application with amendments for number 7 regarding the disciplinary action
So you
that
would
has not been annulled or expunged.
correction to his application.
Correction to, yes.
Is there a second?
Ross,
Hi.
the motion.
Great. Do I have any opposition to the acceptance of the application for John Fox with a correction to box number 7 of his application? Hearing none, the motion is passed. Thank you. The application for Janice Pitts by the applicant has been deferred at this time. Moving on to Mr. Tyler Cronquist. Is there a motion for his application?
I, Stacy Calino, I move to accept the application for Tyler Conquest.
Ross, second the motion.
Thank you. Anyone opposed to the acceptance of the application for Mr. Cronquist? Hearing none, the motion carries. Moving on to the physical therapist assistant application. First application is Miss Erica Pinera. Is there a motion for the applicant?
I, Michelle Chi, motion to accept this application with corrections to box number 7 regarding a crime that has not been annulled or expunged.
May I get a second for that motion, please?
Ross, second the motion.
Is there any opposition to the amended? Hearing none, the motion for the acceptance of this application with corrections has passed. Our final applicant, Mr. Dylan Enriquez. Any motions to accept on his application?
Ross, motion to approve Dylan Enriquez's application.
May I have a second?
I, Michelle Chi, second that motion.
Any opposition? Hearing none, that motion passes. Okay. Moving on, we have a list of license applicants. I, Cindy Tamayo, move to approve this ratification list. May I have a second?
I, Stacy Calino, I second the motion to pass the ratification list.
Does anyone oppose this motion? Hearing none, this motion passes as well. Thank you. Okay. The next item on the agenda is the 2025 legislative session. There are several things on here. Did everyone review all this?
Let's check for a chair. Let's check for a public testimony.
Is there anyone who would like to provide testimony on either of these? The first one, the proposed legislation relating to administrative licensure actions against sex offenders. Is there anyone who would like to provide testimony for this bill?
Thank you, Chair. We do not have anyone requesting to provide testimony.
Thank you so much, Johnny. We just need to discuss it.
Yes, so that particular bill is an administrative bill and it affects your chapter. So
Yes.
we need to have a board's position with this bill. It's did everyone get a chance to read the bill?
No, we read it.
I got through it.
Whether you understand it all, that's another.
Right.
It's very interesting because when I was at FSBPT, I believe this is what I actually reached out to you about, right? Was our expedience
Similar.
for sex offenders. So when I saw this come up, I'm like, well, that's very timely. Yeah.
Yeah, so this allows us to be able to provide a better, faster response, I guess, with regards to actions on a licensee if they are a convicted registered sex offender.
So it's mandated that they are not licensed if they are a registered sex offender.
So this one allows us to revoke the license.
Or denied.
Or
Deny. Yeah.
actually, if you read that.
So it's an allowance, not a mandate.
Renew it.
Yeah, you can. Yeah.
Would the process be RICO?
Like how does?
No, I think it's administrative.
So I guess the procedural process, that'll like once, if the bill does go into effect, that'll have to be like worked out on how that automatic renewal happens and just procedurally how that would look like. Typically, right now, the way it works is if someone's convicted, then it would go to RICO to do the administration, but this law kind of makes this kind of automatic language, so kind of have to figure that out once if it happens.
Just faster,
Yeah.
so that they're not out there treating patients or doing whatever while they're waiting for this decision.
Yeah, and then this, the bill uses the shall language, so it's kind of like a mandatory denial or revocation if there's if they're convicted of these sexual offenses under 846.
It does it, I know you sent the definitions out and that, and this is just my own little thing. So all sex offenders or certain classes, I know you guys were talking about it before the meeting, because the only reason I ask is I know I have had experience in the past, like a 19-year-old male has a 16-year-old girlfriend, they consensually engage in sexual, and then the parents get mad and because he can be considered a sexual predator or whatever, because he's above the age of 18. Would that also, is it like everybody who, that's my only thing, because I hold them at a different level than,
Yeah, so I think 846E, it lists the type of sexual convictions that would be considered automatic revocation. So there's, kind of difficult to go through all of them right now, but it's essentially sex assault 1, sex assault 2, sex assault 3,
okay,
sex assault 4, but it doesn't include like indecent
exposure,
exposure
yeah.
or something like that. So there's some, it's a little specific on what would be considered sexual offenses for that statute.
Yeah, because that obviously people who are already holding a license, that wouldn't be an issue because they wouldn't be a therapist at that point, but yeah, okay.
So the board needs to form a position whether you are supporting the bill, not supporting the bill, supporting with comments.
I would support the bill if it will speed up the process for revoking license for someone who's licensed. And also to maintain the safety for the community for someone who's coming in and asking for a license. I mean, I don't have a problem with that. It was just that that piece, because the definitions are, it's pretty far, like goes from one end to another. It's sex offenders, it's a large net.
Yeah.
So
Do we
that's
know
the
how many other states have similar legislation?
So actually, if you read the beginning part of the bill, this was brought on because of a Civil Beat article that they had posted against against an individual who was convicted here in Hawaii and who has a PT and an acupuncture license. And we couldn't they weren't able to, we couldn't just revoke their license like faster. They had to go through investigation from RICO and all of that stuff. So on the other hand, he also had a California license, and California has a law which is similar to this one, and they were able to revoke his license almost like pretty fast because of that law. So this is why we're bringing this to the legislation in order for us to do something similar to what California has done. So California is the answer to your question.
Yeah, I believe there were some others too, because it was a topic that we discussed at the meeting, and that's why I had, like, do we have something that can speed this? Like, how does it work? So I think it's probably going to be more widespread if there aren't. You know, if California is the only one, I know he spoke to it because he speaks to everything, but yeah, I would support it. It's definitely public protection.
Yes.
Right, I support it as well, you know, and if not revocation, at least suspension, right? But this is an already convicted person, so you guys, you made that distinction that we're not talking about every single type of assault or sexual misconduct. It's really a specific of the more severe types of sex offender, and
The bill does specify on what offenses.
right. So I like that specificity so that it doesn't cast a large net and sort of prevent people, you know, who might necessarily revoke a license, maybe suspend or review a license, right?
I think it's interesting that they removed exposure. But an interesting thing, but whatever.
Ross, any comments?
Yeah, I'm fine if it speeds it up, but I think usually these are case by case things, so I guess the suspension thing, I can see what Stacy was saying. Can be like a thing to review, but if they're convicted, then I guess that kind of, yeah, we can speed that up in revoking. That would be probably better.
We're gonna need a motion for the board's conviction on this bill.
What's the,
So you can make a motion to support, not support.
okay, I, Cindy Tamayo, move to support the bill, the proposed legislation relating to the administrative licensure actions against sex offenders.
I,
Can I have a
Michelle Chi,
second?
second that motion.
Is there anyone who's opposed? Hearing none, that motion is carried. And then the second legislative is the proposed legislation relating to therapy services. This is, I believe, specific to Department of Education therapists, whether they be travelers, contracted or employed by the DOE, allowing them to work out without a physician. referral.
I learned that the Department of Education wants to bill Medicaid for the services.
Well, if they do that, then the state's gonna have to work with Medicaid to accept the therapy without a physician referral. And once they open that up, it's gonna open it up for every, right? Because I can't say in the DOE, you can treat and bill and get reimbursed, but you can't if you work at Kapiolani.
Right.
It's the whole thing with direct access. We
Mhm.
can legally do it, but the insurance doesn't have to pay for it. So when I was first reading that, I'm like, well, they can legally do it if but the state is not allowing within their own rules. They're saying, no, you have to have a physician license. Our rules allow them, but then insurances don't pay for it. So you generally
I
do,
think
except for
that's what,
snowbirds.
when I really read through it and thought about it hard, I mean, that's to me what this bill is really for, is that reimbursement piece. Because when you get referred by anybody, I can refer someone to the DOE for physical therapy, knowing what I know from their inpatient stay. They're going to do an assessment where OTPT and speech sees them, right? They'll have an IEP, which is the entire, everybody sits down in a huge meeting with the parents to discuss it, but it rarely has anything to do with that doctor's signature. You either qualify or you don't qualify based on ability to get around campus or to learn. And so even if you had a doctor's prescription but didn't qualify, you would no longer get DOE PT services. You'd come to outpatient PT perhaps. So to me, the only reason to, unless it's like you said, like this says to speed up the process, maybe. I wish I had a little longer to even find out if that is an issue for people trying to get services in the DOE. Getting a physician's signature when I facilitate getting people in the DOE system has not been my personal issue. Doctors are usually pretty quick within a week to send that referral and the little signature at the bottom that mostly has precautions, contraindications, things like that written on it. Personally, I'm also quite concerned right now, if you're going to get paid by insurance to be seen in the DOE, then you can't get duplicative services in an outpatient setting. And that's a major issue for speech language therapy right now, because they have to kind of choose, are you going to do ABA and school, or are you going to do your augmented communication devices and feeding and speech language at an outpatient clinic? You can't have both. And if this becomes the case for OTPT in the DOE, then I can see that becoming actually a problem in the outpatient setting for kids who kind of need two different settings, one that facilitates their learning in school and the other that might do something else. And of course, if you have two different goals, they say they'll pay for it, but the reality of where I'm coming from is that's not the case. Outpatient therapy would be denied in most cases, right? So those are just some initial thoughts about this bill.
Yeah.
You support the intent?
Definitely the intent. Well, and again, I think some of what Stacy's talking about is not really specified in here. Yeah, you're using your own knowledge, like you have heard or whatever that they're trying to bill, but that's not really in here. So
Well, trying to build, well, in the second part, it kind of just says on the second page, right? By allowing OTPT and speech services to be provided without a physician's referral, the Department of Education can more effectively bill Medicaid for these services, generating additional funding to support and enhance therapeutic resources for students.
will Medicaid pay if there's not a physician referral?
I think that's why they want to make it maybe part of our law. But as far as I know, in the outpatient setting, you need a PCP's. They're kind of gatekeeper. You need that signature, which is again a little tricky for me because a lot of this doesn't quite make sense that Medicaid would allow. You know, their policy and what we have in our bill seems like almost two separate things.
Yeah. Yeah, it doesn't make sense. I don't have a problem with easing the access to the services in the DOE. I mean, if that's the intent. I mean, as
It
far
does
as
make
making more money for the state, I don't, that has nothing to do with us nor public protection. So that's about the DOE making money. So
right. The first part is the purpose of this act is to remove the physician's referral. That I almost agree with, because only the PT, OT, and speech in the school setting typically determine qualified or don't qualify, regardless of the medical diagnosis. And then in the department, thereby streamlining service delivery, I would agree with that. But the part about expanding Medicaid reimbursement eligibility, that part is like, maybe I'm quite confused by how that expands their Medicare eligibility.
Do we know if the students right now are just going to their PCP to get a referral, or is there a blanket DOE physician providing orders?
In my experiences, it is not a DOE physician. It is their personal. It could be a neurologist. It could be the discharging physician. It could be their PCP.
They used to come to Shriners occasionally, like on their clinic visit. I remember seeing them when I used to cover clinic, and they'd have the doctor sign, and it's kind of like a really nondescript thing. But I don't understand, because to me, well, I don't know. Our rules already allow direct access, right? So of course we would support direct access because it's already in our rules. Whether the state that oversees the DOE allows it is really not our call, right? Am I crazy? Because when I was first reading it, I'm like, but our rules already allow direct access.
Yeah,
So-
because HAR 16-110-3, that it already states that in your rule.
Right. So I mean, I don't have an issue with direct access, which is what this is asking for. But the board has no part of what an entity requires for their, like, the board's not going to come to Maui Health and say, you need to allow your therapists to have direct access. That's not what the board's job is. We already said direct access is okay. So the state who oversees the Department of Education, or the Department of Education, has put that stipulation in there. If I'm understanding this, the Department of Education is requiring a physician referral. But that's not ours to decide, right? Because we've already said direct access is fine. Yes, do direct access, whatever.
So I
We've
think
already given that approval.
Yeah, since it's already in your rules, you can support the direct access, but you're providing no comments or
Yeah.
nothing for the rest of the bill, right?
Right. We have nothing to do with whether they get reimbursed for it or whatever. I mean, yeah, okay. We can't say we don't support it because we already have it in our rules that direct access is okay.
Okay. So maybe you just support that portion of the bill.
I mean,
Does that
and
make sense?
it does. And I'm just like really trying to think so hard about this, because it's very, I didn't see this one coming necessarily, but do you think it has to do with the fact that we don't make a medical diagnosis? That a lot of these kids are getting services or immediately qualify, for example, for either the, what is it? I'm like blanking on where you don't actually have physical therapists, but you have some kind of modifications. Sometimes you don't physically need help, but you have your 405, or anyway, so all these different types of modifications they can make to school. But it's a lot of the time, sometimes they're medical diagnosis, which we don't do, but a doctor's autism, traumatic brain injury, right? Those are diagnosis codes. But again, you'd only need those things for billing. And I don't know at all if schools are already billing, and I just didn't realize it.
I don't think so. I can't imagine that they have the structure for billing. They don't, yeah. I really just don't think we have a whole lot to say about this. The only other thing, and I was a little bit happy after I read it, the part about the diagnosis, blah, 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 wrong glasses again. But then they did put within their scope. Because at first they were talking about diagnosis and referral exemptions, but I wanted to make sure that they had within their scope, because I don't want them doing medical diagnosis, like you're saying. We don't want to allow therapists to do medical diagnosis, but they can do a diagnosis within their scope of practice. So as long as that language is in there, I'm cool with that.
Yeah, where they have the like amended portions, right? The highlighted, and says like we can do that, right?
Yeah, as long as they. Yeah, this is the one on page 11, the amendment, that was where I was like, says a licensed physical therapist employed by or contracted with the Department of Education will be able to diagnose and refer for services when providing physical therapy service. They don't say within their scope there. And that makes me a little uncomfortable. I don't know about anybody else, but because if they're taking the physician out and they're now saying they're diagnosing, yes, within the scope of your practice.
Who's
They don't have
initiating
that.
this bill? Do we know?
M2, whoever M2 is.
Oh, page 11.
Yeah, I think all of them have that change until the very end, and they say the services within their scope of practice. And I think that language should be
included.
I don't remember our language. What does our language have as far as?
16.110. It just says that a licensed physical therapist may perform an evaluation of any person without a referral. A physical therapist may treat a patient with or without a referral unless the physical therapist has reasonable cause to believe that the patient has a symptom or condition that is either beyond the physical therapist's scope of practice or for which physical therapy is contraindicated, in which the physical therapist shall refer that patient to an appropriate healthcare provider.
Would that be stipulated in there? I don't know. I don't have a problem with the direct access, but it should be in alignment with what our rules say.
Oh,
right?
Okay. We can support pursuant to the rules.
Yeah. Is that some of that language feels like it's a little bit of an overreach? And I don't know that it's intended to be that, but it's just the way the language is. Sorry, I'm looking up our rules as I speak.
I also have concern in like rural areas if there is not a therapist, but only an assistant practicing.
Yeah,
I wouldn't want initiation of therapy without some sort of oversight, just out of caution for the patient, for the kid in school, you know?
Yeah. And again, that's kind of in the rules somewhat too, but not so much as far as, now we don't have a physician involved, but.
It's well, and that's tough too, because I feel like in my experience, the physician might do the initial referral and then put a very vague diagnosis and signature, and the rest is kind of really, there's a lot of laws around the timing and who has to be included in IEP meetings, and then 60 days for all assessments and 30 days for things to get signed, and then 6 months for an official review with certain people involved in that meeting. So I feel like the structure of the DOE ODPT speech kind of has some redundancy and like checking in, but rarely does the physician ever involved in that process, at least for a year. And sometimes it's a 3-year plan and they're not included again for 3 years. But a PT definitely should be oversighting a PTA. And honestly, here in Hawaii, one PTA is servicing 17 schools. So you've got one PT following, that amount of patients and PTAs, and they're still responsible, however, right, that PT. But rarely, again, really honestly, as the physician providing oversight, other than the annual appointment, hopefully, right?
Would we be opening the therapist up to more litigation on the part of the parents if there was no oversight? Because I mean, our role is also to protect the therapist, correct?
It's more about protecting the community, but
And I think what's a little tough too is like physicians write their referrals to at least for the child to get assessed, and it still kind of comes down to the PT to say yes or no. So in this case of qualifying a kid for services and the frequency and the amount in a year or not, I think that responsibility is already happening and expected of the therapists.
well, that's just like us. Yeah, we do the plan. Physicians have no clue what we're doing.
And there is a lot of litigation, I think, that goes from kid or children not being qualified for services or being discontinued from services and they don't agree with it. And I think there's also litigation in places like you mentioned that don't simply have the staffing to get the assessment done within the 6 months, and now they're delinquent and they can be held accountable through the court system. So the liability may not change just because I think that lands on the therapist's shoulders already.
Yeah. Well, back to the original question. I think we can't go against the direct access portion of it, but we definitely don't want to have much to say about whatever they're doing as far as billing or, whatever. That's not us. We can't say no direct access because it's in our rules. And then as far as the diagnosis, I think it should be clear in all those rewrites that it's within the scope.
I'm also curious if this is a law anywhere else, and like how that has gone. But to your point, I would like to only speak to that yes, direct access is a good idea and getting kids services efficiently is a good idea. And the rest of it, I don't have much of a comment.
Okay.
I think we need a motion. Stacy.
Okay, I, Stacy Kili'inoi, motion to agree with the direct access of occupational speech therapists and physical therapists in the setting of the DOE to provide services and diagnosis within our scope of practice.
I, Ross, second that motion.
Just a clarifying point. Can we make a motion that includes the other services, or should our motion only speak about our physical therapy portion of it?
Yeah, just the physical therapy.
You want to revise? You did such a good job. Just revise.
I, Stacy Kili'inoi, revise my motion to specifically include physical therapists in the direct access in the DOE setting.
I, Ross, second that motion.
Any opposition to the motion? Okay, hearing none, that motion carries. Question clarifying again, do I need to make a motion to add the language about within the scope to those If you're nodding your head, I can't see you.
We can add that into the testimony, and I think it's
Okay.
been in discussion, so.
Okay,
And,
okay.
Stacy, I believe you are our legislative liaison, so, I can work on the testimony and you can look it over, make sure that it's within the board's, it's within your discussion, the testimony that we're providing. And I think Ross is,
person.
our volunteer too.
I think he's step out of this DOE question though. He can
Sorry,
get
what was that?
all the ortho stuff.
Okay.
Okay, I think that. Okay, I think everybody saw the inclusion of the 2025 meeting schedule. The next meeting is scheduled to be March 11th, Tuesday, and this one will be in person. I can make it as long as my daughter doesn't go into labor early, because
Ooh.
I'm not going to be here.
We
I'll be-
can, yeah, we'll check
Yeah.
back with everyone on their availability, but so far this is what we have. Right
So
now.
far, I'm good as well.
Ross and Michelle?
I'm good.
Okay,
Too.
thanks. Okay.
Awesome. Okay, I move that we adjourn the meeting now at 2:27 PM. I don't think anyone is going to argue me.
All right, thank you.
Thank you. Thanks for all your help. And thank you for stepping in, Andrew.
Thank you.
Is it going to be a regular thing now that Christopher has a new job?